in earlier days, like female infertility was more, but nowadays the male infertility has also increased, and it's about equal to the female fertility. So what are the reasons for that, ma'am?
Okay. So even for male infertility, what we are seeing nowadays, again the same lifestyle issues are the major problem. So in lifestyle, we will include diet, will include exercise or any physical activity, habits, your environmental exposure to chemicals or occupational exposure to chemicals. So mainly food, again same thing, that pesticides, endocrine disruptors, all those going to affect. Smoking majorly can affect the sperm quality, motility, and even the numbers. Alcohol, if you are like chronic daily intake of alcohol, if it is there, then even the sperm count can become zero. So it can affect the number, it can affect the quality, it can affect the motility. If it is like borderline motility and count, and if you stop consuming alcohol, then we have seen improvement in hormones, we have seen improvement in the semen parameters also. Also, smoking affects DFI. DFI is DNA fragmentation index. So the sperm's DNA will be more damaged if you are a smoker. So this DFI, if it is high, then it can result either in the fertilization failure, or means embryo will not be formed, or it can also result in miscarriages. If the embryo is formed, it can result in miscarriages. Even passive smoking is not good. If the husband is smoking, wife has passive exposure to the smoke, that is going to affect her egg quality, it's going to affect her egg number. So even passive smoking is not good. So it's better for your general health also and for fertility also that you avoid smoking and drinking. Sedentary lifestyle is a major concern nowadays. No physical activity at all. Now they are saying that sitting is the new smoking. That much it can affect your health. So if you are sitting for long hours, it's going to affect your BMI, your the entire physiology of your body. So if your job is sedentary, make sure that you at least have 10,000 steps in a day, or you have some physical activity in the form of some sports like badminton or swimming or whatever you like, dance, aerobics. So all those things will, if you are practicing, it will keep you more fit, and it will keep your fertility also at good level. Also, we are seeing higher incidence of thyroid and polycystic ovary, again because of endocrine disruptors and lifestyle issues. So we spoke about diet. You should be consuming high protein diet, low carbohydrates diet, and more fibers in the form of fruits and vegetables, which will also give you antioxidants and vitamins. So your diet should have at least 6 servings of fruits and vegetables in the day, and protein content should be good, carb should be less. So diet is one thing. Avoid junk food, because all these junk foods, they have preservatives, which are again chemicals, which will affect your all your hormones, which also affects your liver function, affects your ovarian function, your testicular function. So avoid junk food, avoid smoking, drinking, have a healthy active lifestyle, and also environmental exposure to chemicals. Suppose where you stay, that area has some industrial this thing, then you may have to consider either having some air filters at home, or maybe using mask when you are getting exposed to those areas, or if possible, if you want to shift to a area where there's no much exposure to these smoke or industrial waste, so that can be considered. Other exposures, if based on what work you are doing, so certain dyes and paints and chemicals, or printing presses, all those will have some chemicals. Even those who work with pesticides, so they have higher exposure to this organophosphorus compounds, which are endocrine disruptors. So then you should take special precautions to use the equipments to protect yourself, like maybe mask, gloves, and other body gears which they recommend. So that is also important. Then if you are using some resins or something, again those fumes which are getting inhaled can affect. avoid taking any over the counter drugs. Many patients, they like, we have seen that because they are aware that somebody else is given some medicine and this is for this reason, so they go and just buy that medicine and consume by themselves. So that is something to be avoided. So all these chemical exposures because of packaged foods, preserved foods or junk foods, or environmental or occupational exposure to chemicals is to be avoided.